Welcome back to the European University Cyprus School of Medicine new and transfer student orientation. The Department of Dentistry, class of 2025, and the Department of Medicine, class of 2026. We would like to call upon Professor Elizabeth Johnson, our Dean of the School of Medicine, to present the medical school curriculum, objectives, and goals.
Thank you, Sophie. Very briefly, I'm going to give you an overview of what the medical school curriculum is like, so you'll be prepared as to what to expect during this term. Following my presentation, you're going to hear a presentation from the chair of the Department of Medicine, who will be giving you more details about how you'll be functioning. In order to tell you about our curriculum, I think maybe we should answer the question, what is a modern curriculum like? When we look at a modern curriculum, we need to see what's the difference between the old world and the new world. And this is changing how then we teach. Medical doctors in the old world, when they were practicing, they practiced as individuals. They knew everything and they were God. They did everything on their own. Today, however, we know that medical practice is done as a team. That teamwork is essential for good medicine. What was the source of knowledge in the past? In the past, source of knowledge was simply, as a doctor, you were the expert. You knew everything. Today, however, the source of knowledge is the evidence. We are required to look at the evidence. You're going to learn how to review the evidence. What about education? In the past, in the old world, no new education was necessary. Whatever you learned from medical school, that was it, and you were a doctor, you were the expert, you were an individual who knew everything. Today, we know that's not true. Today, we know that continuous medical education is a must. This changes the way that we teach. This changes the way that you're going to learn. Today, we can say that the three most important words in studying medicine are, I don't know. And you will learn to be able to say that easily. Our professors will be saying that. I don't know. We have to look for the evidence. Why do I say this? And I showed this slide yesterday. Is because over the next 20 years, medicine is going to change more than it has the last 2,000 years. Why else did I say this? With all of these changes and all of the things that we're teaching you, the knowledge that we say today, tomorrow may not be true, or parts of it may not be true. And the problem is, and this is what was said by Sidney Burrell, the dean at Harvard, is that we don't know what part of this knowledge is not going to hold true in the future. And then there's the problem of plenty. And what do I mean here? Yesterday, I told you in my introduction that medical knowledge is doubling not every 2.5 years, but about every 2.5 months. What do I mean here? Last year alone, there were 6 million scientific articles related to biomedicine. Certainly, nobody's going to read 6 million articles, but it shows the magnitude of change. So these are problems that we have to deal with in medical education. What was the past and how we act now in teams with evidence, this vast exponential change in knowledge. And these are the things that impact on a curriculum. So what is a modern curriculum? A modern curriculum is the curriculum that we have devised. It's competency-based, integrated, and spiral. A lot of words describing a curriculum. What does it mean? It means that we emphasize the integration of knowledge into medical practice so that you are learning to function as a doctor with the basic knowledge and the primary skills and competency. And it's spiral. It increases as you go through the years. I'll give you a few examples so you understand what I'm talking about. In our curriculum, which is very well devised, you have 3 major spirals. Phase 1, which is called Foundations in Medicine. Phase 2, which is called Foundations in Clinical Practice. And Phase 3, which is the Clinical Medicine Core. Phase 1 is the year 1 and 2. 2 basic years where you learn basic things about the human body. And actually, you're learning about the human body in health. Phase 2, which is the foundations of clinical practice. You've learned about the body in health, you've learned your anatomies, you've learned your physiologies, you've done your biochemistries, you've done your histologies, you've done your embryologies. Now you're ready to learn about the body in disease. This is phase 2, foundations of clinical practice. It's the 3rd year in our curriculum, a very important year, a very pivotal year when you change over. And then the last 3 years are the clinical medicine core, where you're then exposed to all of the clinical rotations. You do your clerkships, junior clerkships and senior clerkships. Let me tell you about this spiral. In the first year, and this is just one example so you understand how we build on knowledge. We use basic knowledge, we build on it each time, you have the same basis, and each time we add more. So in the first year, in structure and function, health 1, the human body in health 1, in the second semester, you'll be doing anatomy. The nuts and bolts of the human body, that is the bones and the muscles. For example, you'll be learning about the thoracic wall, the wall here of the chest. You'll learn the bones, you'll learn the muscles, you'll learn some landmarks and so forth. One semester later, you'll be able to relate what you've learned about the chest wall to find landmarks for the organs underneath. These are the surface landmarks so that you can auscultate, so you can hear the heart, so you can hear the lungs. And here you can see our students using their knowledge the first semester and relating it to the second semester. Remember, I said the 3rd year is a very critical year where you learn about the body in disease. You relate that knowledge in the 3rd year to the physical exam. Already in the 2nd and 3rd year, you're beginning to do the basic things for the physical exam. That prepares you then for your clinical years so that you can do your basic doctoring, your basic functions as a clerk in training, respiratory system, cardiology, and everything else. This is one example of what we call that spiral of moving forward. So now that you understand what our curriculum is like, I'm not going through all of the classes. I believe Professor Xanthos will give you a better feel for about the teams and things that you'll be doing. And you've seen our curriculum on the program. The question that you might ask is, well, what is my life going to be like when I start here as a medical student? Now, students, we're not having a normal semester this semester. This semester, because of the COVID, we are doing things more virtually. We are doing things online. But when you come, when you join us, what you'll be seeing in our labs, in our lectures, is something as follows. We have introductory lectures, which will be starting next week. Our introductory lectures will give you basic concepts about what you need to know. It's not going to go through all of the details. It's not going to give you all of the detailed information. It highlights the most important information, and it does it in an integrated approach, so that the histology is tied with anatomy, is tied with physiology, is tied with biochemistry, so that it comes together in a solid package. A lot of your work, especially in your laboratories, but also in some of your lectures, it's done by teams. We call this TBL, team-based learning. You'll hear a lot about it, and actually later today you'll have the chance to meet your advisors and your larger team. Why? Well, I told you just a few minutes ago that TBL, team-based learning, the team is very important in modern medicine. So from today, from the onset of your clinical career, your career as a young doctor, you're put in a team. You learn to appreciate the impact of the other members of your group together. It also improves your learning. It improves your cooperation and communication. And so you're going to say, well, Professor Johnson, why do I want to improve my cooperation and my communication? As a doctor, you need to communicate. You're going to communicate with your colleagues. The surgeon is going to communicate with the radiologist, who's going to communicate with the pathologist, who's going to communicate to give a diagnosis. Then you need to communicate with the family. Then you need to communicate with the patient. So good doctoring, good medicine is based on teams and is based on good communication. So by putting you in this team-based learning, we're setting you up, we're teaching you how to be a team. And very importantly, the TBL, team-based learning, teaches you professionalism. You start from tomorrow acting as a young doctor, as a young professional. What about our wet labs? What is a wet lab? A wet lab is a lab that we do experiments in. Biochemistry, biology, cell biology, and so forth. Why? We do it because you get the experience of handling tissues. You get the experience of handling fluids. It advances your critical thinking, and it allows you to analyze data. Why analyze data? Remember what I said a few minutes ago? 6 million new scientific articles? You need to be able to look at the evidence. This gives you the training for that. We have structure labs. We allow 3D comprehension for anatomy, internal organ relationships, introduction to clinical skills in some of these areas. This includes virtual reality that you'll see a lot in histology and embryology, augmented reality, and we base a lot on computer-assisted learning. Why? This gives you the opportunity to work a little bit on your own, study on your own, and approach the material in an independent way. So I told you very briefly about our spiral curriculum, how you're going to advance. I told you a little bit about what it's like to be a student at EUC. And now I'm going to say, what are the cornerstones of our medical program? The most fundamental cornerstone is that we involve active learning. We're not going to sit in front of you in an auditorium and give you a load of information. We're going to encourage you to actively involve yourself in the learning process. So yes, in anatomy, in histology, in physiology, in pathophysiology, in semiology, you're going to be actively engaged, actively involved. This is part of your team-based learning and your basic learning skills. You're going to be challenged to think critically. You're going to present clinical problems. You're going to use that basic knowledge to present it. You're going to give clinical association, you're going to listen to clinical association lectures. You're going to present posters where you dissect biochemical knowledge, cell biology knowledge, and when you say, is this really important? Yes, it is. And you'll be introduced to medical practice very early on. Already in your second year, the first semester, 3 semesters in, you're going to receive your stethoscopes, as you see here on the first day for Physiology 2. You'll be learning how to use these early on. You're a second-year student who's just now learning the anatomy, the histology, and the physiology of the heart. And remember, we talked about the surface landmarks based on what you did the semester before. So already you're going to be exposed to this. And one of our major milestones and landmarks and cornerstones is the advanced medical education. And here I'm talking mostly about simulation. Simulation and skills training. This is a fundamental aspect of the competency-based training that you will receive in our curriculum. So what am I talking about when I say simulation and skills training? Well, let me tell you what we have that you will be exposed to and you'll be living in for almost 3 years. It's our simulation and skills training complex. We have high fidelity simulation complex rooms. We have simulated outpatient consulting rooms where you learn how to interact with patients. We have procedure skills training room, and we have a standardized hospital. We have a room that looks like a real hospital where you will learn how to act as if you're in a real hospital. This space is very high-tech and very advanced, and what I'm showing you here is that it's received awards. So what is simulation? I'm saying this, you're going to be doing it starting your second year, and you're going to say, well, okay, Professor Johnson, what exactly is simulation? Simulation is an amplification of something that's real, a real experience, but it's guided. It's a guided experience that allows the normal events to be amplified and to be substantial in experience. So it's interactive, you become part of something, but it's controlled. What kind of simulation do we have? We have high fidelity human patient simulators. We have the task trainers for skill teaching. We have standardized patients, and we have virtual reality. Let's take a small peek at each of these. A human simulator, what is it? It's a mannequin, a doll, that looks and acts very human. It's in a hospital room, a real hospital room. It has all of the equipment of a normal hospital room. These simulators, these mannequins, these dolls are programmed to act normally or to act abnormally in a clinical situation and respond. They're controlled by our faculty behind. So here you can see teams working together to deal with this patient. It gives you a chance to practice working as a team and working with complex situations, clinical situations, before you go to the hospital. Standardized patient. What is a standardized patient? Standardized patient is an actor who is trained to act like a patient who has specific problems. They have makeup, they respond, they ask questions, they respond to questions as if they were a real patient. Why do we do this? Because you learn to communicate with the patient, you learn to make a diagnosis, you learn to interact. These are highly controlled situations and very important part of your training. Task trainers. Task trainers are very fundamental. We have lots of task trainers. You'll learn how to put in IV lines. You'll learn how to do intubations. You'll learn how to do a spinal tap. You'll learn how to do a cardiogram. All of these are skills that you will be trained in through your second and third year that you will know how to do before you go to the hospital. Basically, by our simulation program, you're learning basic and advanced skills. More importantly, you're learning how to diagnose and treat, and you're learning from your errors. You're learning from your mistakes before you go to the hospital. So that is our training in the preclinical years. And you'll hear more details of the preclinical years and our preclinical curriculum from Dr. Michailidis, who's one of our primary instructors in the primary preclinical years. Then we move to the clinical program, where you have clerkships. In our clerkships, where you're acting as a young doctor, you're going to be going to a multitude of hospitals where you're going to be experiencing multitude of interactions with doctors and patients throughout the 3 last years of your program. You'll be hearing about the clinical program from Dr. Khadiyurio in great detail about how you're expected to act and what your program is like. In addition to the hospitals that we have throughout Cyprus, we also have hospitals that we have exclusive relationships with in Hadassah, in Israel, in Greece, in Yaso and Iyea, where you may end up going if you want to do your clinical practice there, as well as in Cyprus. Now your question is, okay, this sounds really nice. I understand the curriculum a little bit. It's spiral, it's integrated, meaning all of my courses sort of make sense and tie together. I'm adding each year onto my experience. I have a preclinical curriculum, which gives me some basic competencies and skills that prepares me for my clinical curriculum. And then you're going to say, okay, does it work? Yes, it does. And here I've simply put a few examples, and I'm going to show you 2 major examples that this program works. Every year, there is the Business Engineering of Surgical Technologies Innovation course in Strasbourg. This is an advanced course. It's for senior medical students, and it's for young doctors. Our students have gone in the 4th and 5th year, and they've performed exceptionally. They've come back with awards. There's another course that takes place in Greece. It's with the UK, Greece, and Cyprus students coming together to learn basic skills, surgical skills. Actually, the first year we sent our students there, we realized that our students were far more advanced, and now a large number of the EUC students, which may be you tomorrow, serve as junior instructors. They don't go there to learn, but they go to serve as a junior instructor. Taken together, this entire curriculum is fully recognized. We're on the USA recognition platform for the ECFMG. We're on the European recognition platform with the IMI. And we are internationally recognized, having passed the accreditation through the World Federation of Medical Education. I'm saying this not because you need to know it, but I'm saying this to realize that your curriculum has passed through intensive scrutiny and is passed with flying colors. But a curriculum is not just the classroom, and it's not just the lab. One of the things that you'll be required to do is a medical thesis, which you will be hearing about tomorrow. What does this mean? It means that research is important as well. You'll be exposed to research. You're going to develop a scientific profile. We have an annual congress, the Biomedical Scientific Congress. This year, it will be postponed a little bit and will be online. But when we do this congress, you as students have the ability to experience and interact. Just alone last year, we had Professor Sir Magni Yacoub, a very big name in cardiovascular surgery. Our students had the opportunity to interact. These interactions, these connections are necessary for your tomorrow. What else do we have as part of our curriculum that you will also be hearing from Professor Patricios, the Deputy Dean, tomorrow? Student summer externships. What is this? It's a short period, 1 month, 2 weeks, 2 months, where you're allowed to do either research or clinical experience abroad in many countries and very high level. In the US, we have 7 placements. This includes Schreiner Hospital for Children. This is for a surgical placement. Alpert Medical School of Brown University, Johns Hopkins University, Perelman Medical School of the University of Pennsylvania. Very high-level areas that you can go. In the UK, we have 14 different placements that include Oxford, Guy's, and St. Thomas, a large number. These are both clinical and basic science research. In Israel, for those of you who are interested in research, we have 3 placements. 3 placements in the labs of Nobel laureates where you can learn basic science research. Tell me that 1 month in a Nobel laureate like Professor Arayonath's lab is not something that you would like to have on your CV. In 2019, we had over 60 placements, and in each placement, several students in 10 different countries. What else about your life as a student? You will have a scientific profile that is also augmented in your participation of the CAMES meeting. It's the Cyprus Medical Association of Students meeting, where you will make workshops, where you will present with the aid of your faculty. Our students are very active in putting together workshops for training, for example, the surgical skills workshop for doing suturing, whatever. You're free and we support you to do various things. Connecting with society is also very important. Connecting with society, our students, and we encourage you to help out. Go to hospitals, help children during the Christmas time, to do charity work for children, to do researchers' night, to inform children of various things, biology workshops for children. We have a program called Watch Your Heart, Keep It Young, where students go together with Dr. Carpetas, one of our faculty members, across Cyprus to teach people how to take care of their heart, how to watch, Special Olympics, antibiotic resistance days. The list goes on and on. So in addition to your scientific curriculum, in addition to your educational curriculum, you're also encouraged to participate in the community. I'm very proud that last spring, during the COVID crisis, many of our students volunteered, many of our clinical students volunteered at hospitals to help with the manpower shortage. By doing simple things such as examining each person as they came into the hospital. So if I'm going to step back and tell you about our curriculum, yes, we have a really, really strong educational program. Preclinical and clinical, which you'll hear about later today. Spiral, allowing you to develop your competencies and your skills. But your curriculum is not just your class. It's not just your lecture, and it's not just the lab. It's part of your scientific growth as well. Remember, we said you need to review the evidence. So you're embedded into science. You're embedded into the community. Our motto is medical education, research, and community service. These are the things that you'll have the chance to expose yourself to throughout your years. Having said that, again, I'd like to welcome you to EUC School of Medicine, and I wish you a fruitful start next Monday. Thank you. Sophie.
Thank you, Professor Johnson. We would now like to welcome Professor Theodoros Xathos. He is our chair for the Department of Medicine, and he will be presenting how you would understand your academic schedule and teams.
Thank you. Sorry. Once again, welcome. And before I start and discuss a few things about how the academic schedule of the first year is going to run, I want to say a few things. And the first thing is that something that we heard from the Dean, and it is always the Dean's job to inspire. And one of the things that the Dean said today is about communication in medicine and about team-based learning. I couldn't agree more. Even from 1990, even in 1990, we have seen that Sexton, in a very prestigious article published in JAMA, said that miscommunication in medicine is responsible for 90% of the medical errors. And in fact, a very recent publication from the Royal College of Surgeons highlighted that whatever happens in an operating room and the mistakes that happen in the operating room are part of this miscommunication. So team-based learning is an important component of our curriculum, and it has nothing to do with what I'm going to say, but I was just inspired by what the Dean said, and I just wanted to share this piece of information with you. Now, I know that the majority of you come into the School of Medicine and you expect to be exposed immediately into the thrill and adrenaline of human disease. But this is not the case. As I have told you, I am here to be honest and realistic with you. And through my honesty and realism, I'm going to say that the first semester is going to focus on what we say basic sciences. And those basic sciences are biochemistry, physics, cell biology, biostatistics, and a very innovative course that we've got called Practicum. You will receive the detailed schedule from from your advisors, where you will actually understand where you are supposed to be at each specific time. However, the main concept of this slide is to tell you that each day is dedicated to a different discipline. This is not normally the case in the School of Medicine and the Department of Medicine, where the disciplines are being spread throughout a week. But during the COVID pandemic, we have to make adjustments in order to cope with the increasing demands of the healthcare community, along with the measurements of the government for social distancing and protective measures. Now, medical biochemistry, physics, cell biology, and biostatistics are courses that I used to hate when I was a student. I believe that they had nothing to offer. They didn't contribute anything to my knowledge as a doctor, because what I needed to know is how to make a diagnosis. I had to spend 40 years out there in the real world to understand how important those courses are. And it is imperative that you get the grasp of what you are doing from these courses now, before it is too late, before you become like me, when you are old, and then you have to go back and look at your basic biochemistry cycle. So we have the lectures, and you will see that the lectures of all the major courses, other than the practicum, which is only for 1 hour, they're basically 3-hour lectures, block of 3-hour lectures. These lectures, as the Dean has said, are going to be delivered completely online. And I'm going to tell you how you will be connected in details and how things are going to run a little bit more. However, the majority of what we are doing, because the Dean said that this is a skills-based curriculum, and you cannot have a skill if you cannot have a lab. And as a result, the majority of what you are going to learn in this university is through labs. Now, again, if we were running a normal year, the labs would require your physical presence, and as a result, you would need to perform the experiments as they were happening in the lab. However, now, because of the pandemic, this semester is going to be almost run virtually. And as a result, the labs are going to follow the lectures of the same day. Don't worry when you see, for example, that the Monday labs start at 1:30 and finish at 9 o'clock in the night. You don't have to do all these long hours. You will be divided into teams. You will be divided into groups. And the Dean has stressed, I have stressed the importance of that as well. You will also see that we have left your Tuesday free. So you have no labs on Tuesday, so you have some time to study. Wednesday is biology, which is again a huge lab, but you will be divided into different groups. You will be divided into different groups in biostatistics, and you will hear about all this information coming from the first day of instruction from your instructor, and the final day of the week, the Friday, is the clinical practicum. The clinical practicum is the early exposure to the clinical practice. So we teach you basic things that a medical student should know and should be able to practice. You will also hear that you will belong in groups, and we will have several groups. In fact, we've got Group A, Group C, Group D. But each group has several subgroups. And we have Group A, for example, with subgroups A1, A2, A3, A4. So in Group A1, the people consisting in Group A1 will be 4 to 5 to 6 students. You will be informed on the first week of instruction what your allocation is going to be. So you will know precisely what your allocation will be. And this allocation, so for example, Theodoros Xanthos belongs to Group C3, will be carried throughout the year. So you will know what your allocation is, so you will be able to follow the lab plans of the instructors as they've been uploaded into the several platforms we will explain later. And each instructor or each course coordinator will send you a very detailed program for each group and subgroup. So, for example, you will hear, and this is just an example, that Group A1, A2, and A3 will perform this type of activity in biochemistry between 1:30 to 2:30. The other activity, a second activity, between 2:30 and 3:30, and so forth. I have some more information for you. I know that you may not need it, you will not need it now, but you will definitely need it when you come to campus. We have a Wi-Fi for our students, and the code of Wi-Fi is here, is student 0409, I'm sorry. This Wi-Fi gives you access to various platforms and various libraries. Remember that because this semester is going to be virtual, almost virtual for COVID permitting, you can get internet support at the email that you see here, which is support@euc.accy. Especially for biochemistry and biology, you will need to take a safety test. The safety test is a prerequisite. You have heard the accreditations of the school from our dean. In order for the school to be accredited, the students have to be able to perform in a safe manner inside the lab. And your instructors, the instructors of biology and biochemistry, are going to inform you. You will also receive links. And those links, the first day, you will receive them as emails because you may not have access to Moodle immediately, but you will receive links like the one that I'm sharing with you now from Blackboard Collaborate that look like that. They are not the same. Each link is going to be different, okay? But they look like that. They start with eubbcollab.com/things afterwards. There are two things that you need to remember. All the courses can be found on Moodle. Once your student account, your email has been activated, you've got access on Moodle. On Moodle, you will find the courses where you need to enroll. In order to enroll, you need the enrollment key. The enrollment key will be made available centrally through the administrators. So everything, all the courses, biochemistry, biology, biostatistics, physics, along with practicum, can be found in Moodle, and there you have to enroll. Some courses run on Blackboard. For the first years, we don't usually use Blackboard. We use Blackboard for years 2 and 3. We have some practical tips. Remember that the only email that the university is using to communicate with you is your university email. We don't use and we don't keep personal email. You need to check your Moodle accounts and the courses that you are enrolled for announcements. Your instructors will make schedule announcements on Moodle. And you need to follow your schedule as if it is holy. One of the best qualities of the doctors is punctuality. And we expect punctuality even on the online activities. A few things about hierarchy. The school has a dean, and the dean has a deputy dean who replaces the dean. The department has a chair, and the chair has a vice chair who replaces the chair. Now, the academic ranks of the dean and the chair are professors. So, the only people who are called professors are those who hold the rank of the professor. And it's not only the dean and the chair, but other professors as well. But the dean and the chair ex officio have the title of professor. All the other ranks, associate professor, assistant professor, and lecturers, you will hear us referring to them as members of the faculty, because these are, as we call them, tenured ranks, are addressed as doctors. And we also have scientific collaborators who are used per semester according to the course. And with these, I would like to thank you and once again welcome you to the Department of Medicine. Thank you.
Thank you, Professor Xanthos. We would now like to call Dr. Konstantinos Michailidis, lecturer for the Department of Medicine. He will be presenting information regarding your clinical training at EUC, basically your preclinical training.
Good afternoon. My name is Konstantinos Michailidis. I will be talking about preclinical training in EUC. Before I start, though, I would like to welcome each and every one of you in our school. I wish we will collaborate in a very fruitful and productive way, and I wish you all the best in the upcoming 6 years of your studies. in our school, we don't focus on transmitting knowledge just for the sake of knowledge, but rather emphasize on integrating this knowledge in relation to the practice of medicine. The strategy that we use is competency-based. Sorry. It's competency-based, and the system that we use is it's an integrated spiral curriculum, just like our professor, our dean, said earlier. This curriculum is developed in such a way so as to be interactive, functionally and clinically relevant, that focuses on the practical significance of the content. So what is a spiral curriculum? It is a curriculum in which students revisit the same topic several times throughout the program. With each time of revisit on a particular topic, the complexity of the material increases. So new concepts are therefore gradually built on previous learning. So our curriculum has three phases. Phase 1 includes the foundations of medicine. This is when you will place the groundworks of medicine, and it is consisted of years 1 and 2. Our next phase, which is basically the entire third year, is the time when you will be introduced to the clinical practice. You will learn about the disease. What is disease? And this phase is very important because it basically is the link between phase 1 and phase 3. Phase 3, which makes up the core of clinical medicine, and of course includes years 4 up to 6, is the time when you will be exposed to real-life patients. This is the time when you will be sent in hospitals, clinics, private practices. And that's when you will implement whatever you have learned during the first 2 phases. Now, of course, all of these phases have a purpose, and this purpose is to address 3 types of learning: your medical attitude, your medical cognition, and your medical skills. So just an example on how spiral curriculum works. Let's say that you're on your second semester and you're doing basic anatomy. There you will learn about the thoracic wall, the different bones of the body, perhaps the sternum or the clavicle, and perhaps what organs the thoracic cage contains. On your next step, on your third semester, you will learn the surface landmarks. You will know when observing externally a human being, where the heart is, where do you expect to find the different valves, where the bronchial tree is, where do you expect to hear the sound of the hearts. And lastly, on your third year, you will be able to relate whatever you have learned so far, whatever information you have accumulated so far in relation to physical exams. So therefore, you will be able to have a greater view on systems just like the cardiovascular or the respiratory system. Now, how exactly will your clinical skills evolve starting from your first year and moving to the following years? During your first year, you will get familiarized with the practice of medicine. In the same time, you will be introduced to teamwork and communication skills that should describe a medical doctor, especially the medical doctor of this era. On your second year, you will learn how to take history. Now, taking history is one of the greatest skills a doctor should possess. Taking a right history will get you to the correct diagnosis. Not only will it take you to the right diagnosis, but it will get you there faster. Also, you will be introduced to clinical skills, and you will learn all of this using a problem-based learning. On your third year, you will learn physical examination, all of your auscultation, inspection, palpation, and so on. Your clinical skills will be enhanced and your clinical reasoning honed. All of these, of course, serve a purpose, and this purpose is to prepare each and every one of you for the upcoming clinical years, for years 4 up to years 6. Each phase is divided in different structure and functions. In phase 1, during your first semester, you will deal with molecular medicine, with cellular biology. You will be introduced to medical physics and biostatistics. These are fundamental subjects that you will need throughout your practice in later years, just like Professor Xanthos mentioned earlier. Now, on the same phase, on phase 1, you will then proceed to the next structure and function, which involves the different systems of our body and how these appear and how they function under physiological conditions. So during this time, you will do a lot of anatomy, the science of the structure of the human body. Histology and embryology, I will be teaching most of this. Histology is the microanatomy of the tissue, how the tissue looks under the microscope. Embryology, how the embryo develops, and the fetus as well. Physiology, of course, the science of the subject which deals with the normal function of either cells, tissues, or systems. You will continue with your biochemistry, of course, and there are courses, more courses like genetics, family medicine, human nutrition, neuroscience, medical psychology. You will be introduced to clinical skills. You will have immunology and microbiology and some epidemiology as well. So after this phase, after the 2 different structure and functions, you will have accumulated the right knowledge in regard to what is normal. So progressing to the next phase, phase 2, you will deal with the abnormal, with the aberrant. You will be introduced to disease. You will learn how disease looks in pathology, why certain things happen, how can you reach a diagnosis through semiology. Pathophysiology will explain what went wrong. Pharmacology, of course, in the same phase, will tell you how you can treat a patient. So what are the features of the curriculum? Horizontal and vertical integration. What do we mean by that? We mean well, basically, this is a pedagogical style which aims at delivering each subject as an integrated function of several disciplines. For example, let me help you understand what that means. If you're learning about the respiratory system in physiology during your 2nd week on your 3rd semester, during the same week, you will be learning the same system in different courses, let's say anatomy or histology. Therefore, you will be better prepared to apply a complete conceptual knowledge instead of pieces, instead of fragmented presentation of the same topic. Now, our school has invested a lot on training, and training in our school includes team-based learning, multimodal active learning, student-centered and self-directed learning, of course basic and advanced skills development, as well as inpatient and outpatient clinical rotations. These will come more in hand during your clinical years. So self-directed learning, what is it? It's a type of learning which puts you in the center. It puts the student in the center. the course is built around your needs, around the skills that you need to know, the skills that you need to master in order to practice medicine in the future. So how are they applied? We use problem-based learning. We use problems from which you're able to learn through. Case studies. This could be actual case studies from our practices or made-up studies which will help you learn a particular disease. Now, some courses have projects. These projects could be individual or they could be within the context of a group. Also, we have dedicated rooms which are filled with PCs that will assist you with the computer-assisted learning. So what are the results of this type of learning? We get students that are lifelong learners. We get self-directed learners and students that are able to think critically. Now, I believe you have seen our grounds, you have visited our third floor, and you have seen our simulation rooms. I'm going to pass through them very quickly. We have high-fidelity simulation complex rooms. We have simulated outpatient consulting rooms. We have procedural skills training room. We have, of course, the standardized hospital training suite. We have human patient simulators and mannequins. Although these are not real life patients, they evoke the experience of treating a real life person, a real life patient. And all of this happen under a fully interactive environment. This is effective for developing your medical cognition, your medical skills, and your medical attitude. Standardized patients, just like our dean said earlier, these are specialists trained to portray patients. Why? To help you understand and instruct you and help you assess your clinical skills. You should know that sometimes we might call you to portray a patient. What that will help? What do you think that will help? Of course, this will help understanding. It will place you in the position of the patient, and therefore you will understand the pain of the patient. You will understand how the patient views everything. Meanwhile, some of you will be the carer, the doctor, so this will further enhance your skills. I should mention that all of these are happening under a safe and controlled setting, which is specially made to keep the real-life experience. For example, if someone might have an initial stress and confusion during an office visit, this will be portrayed through these scenarios. Task trainers. We have a lot of task trainers, of course. This will help you practice and master technical components of a clinical task. Revisiting the same tasks will help beginners such as yourself to progress toward mastering psychomotor skills. But senior learners at the same time will be able to maintain and fine-tune their skills. You will learn how to intubate, how to take blood, how to use the ultrasonograph, how to do ECGs. Competence competence encompasses knowledge, skills, abilities, and traits. So each week you will be given a lab plan and a simulation plan. Each plan will have the objectives that you need to master, the objectives that you need to conquer in a specific course. For example, here we have anatomy, we have the shoulder. You need to be able to macroscopically identify this type of bone. Now, just giving you objectives is not enough. We need to correlate these objectives with competences. So if you see, for example, this lab session right here, You can see that there are some particular objectives regarding the description, the macroscopical description of certain parts of the body. Now, as we progress through these objectives, the complexity increases as well. So by the end of these tasks, you will be able not only to identify a particular structure using the expected terminology, but also you will be able to identify that using radiographs. Okay, so you will be able to identify that in 2D. You don't need me to tell you that there will be exams, okay? And we need exams in order to assess what you have learned, what skills if you can do the skills that you're supposed to. Very briefly, I can tell you we have midterms and we have final exams. Midterms are placed usually in the middle of the semester, whereas final exams at the end. Some courses have a practical part, some of them also have a written part, or they could have both. Further than that, though, we also have other methods of assessment, such as reports. Some courses have lab reports, others have assignments. You will be asked to work as a group and present a particular topic. And of course, participation also is taken into account. Now, does this work? Of course it does. And don't take my word for it. Just look at all of these awards that not only our school but also our students have achieved, and you can see that most of these students of us are after the third year. This means that our first 3 years have done the job. We have fully prepared you to be able to cope with the needs that you will have to present. Also, medical students serve as junior doctors in societies around the world. So, concluding, this curriculum is based on the modern way of teaching, and this teaching is the student-centered learning strategy. This is characterized by collaborative learning. We're teaching you how to work as a member of a group. It is characterized also by self-directed learning, in which you choose how you will be taught. Competency-based learning is takes a major role in this type of teaching. And most importantly, in our school, we aspire to develop a community of learners, to develop lifelong learners, to develop confident clinicians, because at the end, we don't just need you to become doctors, we want you to become the best doctors you can be. Thank you for your attention.
We would like to thank Dr. Michailidis for his lecture on preclinical years. Now we would like to welcome Dr. George Hadjigeorgiou, who is also a lecturer in the School of Medicine. His presentation involves the clinical training at EUC and your early exposure in the clinical environment.
Thank you, Sophie. So good day from me as well. My name is George Hadjigeorgiou. I'm a neurosurgeon, and I would personally want to welcome you all to the EUC family. During the next 10 minutes, I will try to give you a brief overview of the clinical training that you are going to meet during the next 6 years of your studies, and try to clarify some things regarding that. So first, we'll describe the structure of the clinical training. Then we'll discuss who is involved in that, when does it start, and in which hospitals are you going to perform your clinical training, how these clinical rotations work, what you expect to learn, and what do you need before starting the clinical rotations. So, what about the structure of the clinical training? We can divide the structure in 3 components. First, we have the classroom-based clinical training, which involves the traditional lectures and the group discussions. And then we have the simulations, which are taking place in our labs with our high-tech mannequins and the extreme skillful personnel of the labs. And the last part involves the clinical rotations in the hospitals and the private offices of your clinical instructors. We are taking quite serious the feedback that we are receiving from your side, and during your clinical training you are asked to evaluate them, and according to the recent reviews of that, the majority of you find them quite useful. Gradually you will learn how to collaborate with your colleagues, how you are going to approach and examine your patients before coming in touch with real patients after year 3. You will build up your clinical skills, you will learn how to suture, how to provide first aids to a polytrauma patient, and how to perform a physical examination from head to toe. Who is involved in this clinical training? Of course, we have this quite confusing tree of our academic personnel, but you have to know who to seek in case you have any problems during your clinical training. This will clarify those things. If you have any issues related to your clinical courses, then you have to ask your clinical course coordinator and the year coordinator. If the problem involves matters related to your rotations to the hospital or some questions about the cases that you have gone through during the day, then you have to ask your clinical instructors. And then if you have any problems regarding the schedule of the clinical training, then either the course coordinators or the clinical division chair. When do you start your clinical training? So we are emphasizing on starting your clinical exposure as early as possible. That means that you actually, from year 1, coming in touch with some clinical experience, and then gradually you build up till year 6. Some of you will have the opportunity from year 2 to access the operating room and attend some of the surgical cases, as your colleagues shown here down on the picture. And actually some of you, up to year 5, will have the opportunity to participate in some case as well, as here with your colleague, Mr. Yelalis, who participated in a spinal fusion operation and actually placed himself a screw under supervision. So this is a practical clinical training and not a theoretical one, and we are emphasizing on that pretty much. So as mentioned before, the clinical training in hospital actually starts on year 4, and then you will have some courses such as cardiovascular, internal medicine, and general surgery. In year 5, you will have the neuroscience and neurology, psychiatry, and so on, followed by ENT on the following semester, and then on year 6 you will shadow the residents and actually build up your professionalism before going out to the field. In which hospitals are you gonna go? So we have the luxury here in Cyprus to be affiliated with the most prestigious hospital in the country. We have affiliations with the American Medical Center, the German Oncology, the Apollonian. We also have the exclusivity with the Larnaca General Hospital, and we also have places in the Nicosia General Hospital, the Archbishop Makarios, in Hippocration and Areteo as well. We also have some exclusive agreements, as the Dean mentioned before, with some big groups in Athens, in Israel and abroad, such as with the Aegea Hospital and TSO, where you can perform some of your clinical training after year 4. So how does the clinical rotation work? Actually, we divide you in small subgroups, not more than 6 students per department, in order to have a personalized training. We don't want big groups going to an office. We want small groups to learn from a physician, and that's why we keep this number as low as possible. Then you will learn how to take a medical history, how to examine a real patient, how to assist during an operation, and actually we will prepare you gradually to enter the professional career that this school will follow. How we documentate the clinical training. We have the logbooks that Dr. Chutis prepared very carefully the previous years, and according to these logbooks we can documentate your clinical training and your learning objectives if they are met. So the logbook looks like that. On the first page you will have some guide regarding your course, regarding your course instructors and the hospitals that you are going to visit, and who are the hospital liaisons that you should seek in case you meet any problem during your rotations there. We have some specific parameters that we examine in order to evaluate you, such as the attendance, the assignments that you will perform, the way you're taking a medical history and how you examine a patient, and all these are calculated from your clinical instructor. We have separate sections that we can evaluate you during your clinical rotation, and at the end we want your feedback in order to try to improve ourselves as well. I will not say a lot about what you will need before starting your clinical training, because this was mentioned from Dr. Karpetas yesterday, but closing I will describe what we expect you to learn through your clinical training. We have summarized the milestones that you should seek year after year. So during the first year, you will be introduced to some communication skills and teamwork, and then as the years comes by, in year 2, you will learn how to take a history, how you will solve some clinical problems, and then in year 3, you will learn the physical examination, you will evolve your clinical skills, the suturing, the physical examination as well, and then at years 4 and 5 you will come in touch with real patients, you will examine them, you will participate in the decision making with your physician and your clinical instructors, and then in year 6 will be the final year before going outside. So you should shadow the residents and prefer your professional attitude as well apart from your medical one. So this was mentioned from Dr. Karpeta, so I won't stay on that. If you have any issues regarding your clinical training, you should contact Harala Bospitas and Urania Antoniou regarding the documentation and all the paperwork that you need. From my side, I want to thank you for your participation, and I want to welcome you to the new academic year and the EUC family. Thank you very much.
Thank you, Dr. Hagiorgiou. We would now like to welcome Dr. Dimitrios Dourakis. He is the Vice Chair of the Department of Medicine and Assistant Professor. He will be talking to you about the importance of skills training in medicine.
Good afternoon. I'm Dr. Dimitrios Dourakis, and I am the Professor of General Surgery at the European University Cyprus. For this next part of the Student Orientation Program, we're going to go through a very interesting presentation about the topic of skill training in medicine. So for the next 20 or so minutes, we're going to discuss about 3 different things. First of all, we're going to talk about what makes a good doctor, what are the qualities of a good physician. Then we're going to discuss about clinical skills, what are they, and why they are important to doctors. And last but not least, I'm going to give you 7 secret tips for improving your clinical skills and explain how we are going to train you and help you improve these important qualities of being a good doctor. If we open up a dictionary and we see the definition of skill, we'll see that it's the ability to use one's knowledge effectively and readily in execution of performance. Okay, this is a little bit too analytical, but in the end, we should keep in mind that a skill requires, first of all, knowledge, but also the application of knowledge, allowing us to do something useful. We also know that when we call someone skillful, or when we say that someone has a certain skill, it means that they have dexterity or good coordination. But again, it applies in physical tasks. So when we're talking about medical skill, it means that someone is skillful, they are good at performing medical acts. So this encompasses different aspects. It's about having the ability, the knowledge, the performance, the dexterity, being able to execute tasks that are important for our patients. So here comes the very difficult question. What makes a good doctor? If we ask around what are the most important attributes of a good doctor, we come up with different answers. Some of these answers is that a good doctor should have knowledge of his topic. He should have knowledge of anatomy, of physiology, pharmacology, and so on. But then it's not about that. We also are required to care for patients, to show empathy. If we want to apply our knowledge, we need to have skill with our hands. We need to be good with hands. Nowadays, the use of technology is essential. We cannot practice without being able to use technology. Hard work, again, is necessary, but also collaboration with others, our colleagues, the other healthcare professionals that are going to take care of our patients, but the patients themselves. In theory, we have classified medical skills in different categories. So here you see that it's about having the knowledge, the professionalism, being caring, being able to function inside a system, because we're working in hospitals, we're working in national healthcare systems, so we need to know what are the basics of the systems and how they function. We need to know how to practice in an environment with other professionals, and of course, be able to communicate with others. To that, you can add the ability to work well under pressure, the attention to detail, problem-solving skills, and the list is endless. We can go on talking about qualities and skills of a good doctor. But we're not going to talk about that. We're not going to make a theoretical discussion about how you can become better doctors. But we're going to focus on clinical skills. And what are clinical skills? If we want to break it down to something very simple, they're the essential elements of doctoring. These are the skills that every doctor applies when they care their patients, when they take care of their patients. Again, the list is not exhaustive, it's extensive, but a few ideas, a few examples to get the idea is that doctors should have the skill of performing a physical examination, using their hands, the stethoscopes and other tools they have to get a diagnosis. They should have diagnostic skills, be able to coin up or identify diagnoses by assembling elements from different sources. Clinical reasoning, being able to make decisions about the welfare of their patient. Communication skills, end-of-life skills, how they treat and what do they do with patients that are going to die and we cannot help them, but still we need to provide palliative care, and so and so. So how do you think students or residents or young doctors are trained into learning these skills? The most obvious answer is that we train in the university, we train in a hospital. Yes, but how do we train? Do we watch and learn? Do we have someone guiding us through? Do we go straight on patients to practice something? Can we study at home? This problem is nothing new. Ever since the beginning of this century and the last century, of course, we had the question of how we can train effectively doctors and prepare them for their clinical practice. So one of the first ideas that came up is that when we want to train doctors, it's not only about giving them books to read. They need to be able to have a direct observation and direct experience with the patients. So what would they do? They would get the patient inside the amphitheater and do a physical examination, proceed with asking questions about the disease and the past medical history and so on. You realize that even though this was a very interactive procedure, it wasn't well accepted by the patients, and you realize that this is not something that we could easily do today and be accepted. The same thing applied to operations. You know that we call the operating room an operating theater, and this is because at the beginning of the 20th century it was exactly that. It was a theater, an amphitheater, where they would put the patient, and under the observation of all the students and future surgeons, the masterful surgeon would perform the operation. In some universities with old tradition, you can still see these rooms that are used now for amphitheaters. Nowadays things have changed, but not quite spectacularly. So we still use the amphitheatric approach. We have experts presenting and sharing their experience. Nowadays, of course, with technology, we can have multimedia input, we can have projectors, we can have screens to show what we want to teach more effectively. And also, in the operating theater, image is now dominant. We can project images from the patient's radiology, from other exams. We can use cameras to enter the patient's body and of course project all that to an amphitheater where future doctors are learning by watching. Watching, of course, is not enough, and this is why we have lab sessions where students are able to practice different skills like physical examination or blood drawing, putting IV lines on models, which means that this is a simulated session. This is not pitting you against patients, but preparing you in order to deal with patients when you go to the hospitals. And last but not least, there are ward rounds, meaning that the students, once they are ready, and this happens mainly at the clinical years, they go to a hospital, they are under the supervision of an attending physician, and there they follow up on everyday routine of the department, taking care of patients and progressively becoming part of the medical team. And now comes the million-dollar question. How can I improve my medical skills? Are there any secrets? Do you have any tips? What can I do so when I'm faced with a patient or with a difficult situation, I can do something to become a better physician? The number one tip I can give you is study hard. We saw from the very beginning that skills require knowledge. So if you don't study, you don't have the knowledge to start with. You need to read your books, you need to study from the lectures, the lab plans, everything that your professors give you. And when you think you've studied, study some more, because we need to repeat our studying. When we leave something aside, we tend to forget it. The fact that I studied something at the university 10 or 20 years ago doesn't mean that I still remember it if I don't repeat this process. This is very important because modern medicine is fast-paced, it's technology-driven, requires high precision, and there is no margin for error. We've taken our lessons from safety regulations, mainly from the airplane industry. And we tend to leave car safety aside. And why is that? Because the odds of dying in a car accident are 1 in 100, whereas in a plane accident are almost 1 to 10,000. So it's something extremely rare. Nevertheless, people are afraid more to die in a plane than in a car. We don't accept plane crashes. We think that this is something unacceptable, whereas we have car crashes every day, and we accept that some people will be injured and some people will even die. This is the difference that I'm trying to explain. Are there any challenges? Yes, there are, and nowadays the challenges are even bigger. You know that we have emergency rooms that nowadays are filled with more and more people due to infections, accidents, and we need to deal with emergency cases on the spot. Intensive care units where patients have multi-organ failure and require support from machines. So we have one patient that we need to monitor by following up on numerous parameters and fine-tuning their function. Nowadays, the COVID-19 disease, patients with SARS-CoV-2 infection that are in our hospitals, they may have other pathologies or they may need treatment for their infection, and we also need to protect ourselves from being infected. So once we have the knowledge obtained, we need to train. We need to put our knowledge to good use. And as we said, there are many ways. You can do it at home. We'll show you how. You can do it in the labs. But again, once you've studied, put this knowledge to good use. There are technical skills like suturing or knot tying or anything you can think of that you can train in the labs. Presentation skills and communication skills. And of course, working as a team and approaching patients with difficult diseases and getting ready to deal with these situations in a real scenario. It's much more rewarding to practice with your colleagues because a team always has a better dynamic than a single person, and it makes lifting the weight easier. But then some people prefer to do it alone and they say, no worries, I can lift all the weight myself and let's get on with it. Nevertheless, make sure that you practice. Do not think that if you do one skill once and you feel that you have the hang of it, that you're ready to apply it to a real case. So practice makes perfect. Now for my next tip, you have technology to your hands and make good use of it. You'll see that we have virtual clinical cases where you can train in dealing with diagnosis and treatments. Virtual experiments where you can see what happens when you administer different solutions or different drugs to the human being. And also, nowadays we use augmented reality either to visualize three-dimensional concepts or to project internal anatomy in our patients. For example, we can see where the location of a liver tumor is in order to help us remove it. Technology also helps us with training our hands. So a lot of surgical training happens on computer task trainers or pelvic trainers. But we don't need to be too reliant on technology because there are simpler solutions that you can use even at home. So we have very complicated plastic models, but you can create your own model from simple materials. A piece of paper, Play-Doh, it's enough to create anatomical models that will help you study. For suturing, you can easily use a sponge. Instead of using augmented reality and projections of anatomical images, you can easily use body painting in order, for example, in the right image, to show what is the anatomical position of the kidneys. And even for complex machinery like a pelvic trainer that is used to train laparoscopic surgery, you can make your own with pieces of cardboard and your own iPad. So you see that the solutions are there if you have the will to create them. Now the next tip is really important. Learn from your mistakes. How can this be done? Well, we say that experience is the accumulation of mistakes. We learn by our mistakes. But you realize that making mistakes when treating patients can be really bad for your patient and yourselves. This is why we use simulation. We can simulate patients by asking students or actors to act that they have a certain disease, or we can use high technology mannequins, synthetic patients that can simulate or emulate different conditions. And this allows students to learn from their mistakes. And in the end, you gain clinical experience without risking anything, because this is a controlled environment. How do we learn from mistakes? So this is the expectation. This is a lab training session where a student is playing the injured patient. She had a car crash and we need to stabilize her neck because she has a neck fracture. So this is the correct way. This is how we show our students to put a neck collar and immobilize the cervical spine. And these are some wrong applications. So on the left we see that the adhesive tape has been placed over the patient's eyes. And on the right side, well, this is not a neck collar, it's more of a rugby mask. Both of these situations would be catastrophic if we did that on an injured patient, because this would risk of dislocating their fracture and leaving them paralyzed. But here, these are just funny aspects of everyday training that remain in our memory and will not allow us to have these wrongly applied collars in real life. When you want to learn something, and I've said that before, it's better to do it with others. So be a team player. Working as a team, apart from studying together, creates some friendly competition and makes you try to be at the same level with your friends. So by doing that, you continuously improve and you have a benchmark to measure your evolution. You can change roles, and we ask our students to change roles from being doctors to being patients, because we need to feel how patients react to us examining them. And when you work together, you can avoid many mistakes, you can get more ideas, you can have brainstorming. In the end, you need to remember that a team is much more better than any of its members. I like to say that studying medicine or passing an exam or passing a course is not a 100-meter sprint. It's more like an Ironman triathlon. And it's the one with the most perseverance, persistence, and endurance that wins and manages to finish first. Hippocrates said that the art is long and life is short. So medicine is so complicated and so evolving that it's almost impossible to perfect it during one lifetime. We go into a circle of studying, practicing, assessing ourselves, passing exams and repeating that, and this sometimes tends to be difficult. So my last tip to you is keep your spirits up. Sometimes this whole process of becoming a doctor is difficult and it will get you to your limits. In the end, I assure you that it's very rewarding. You feel that it's the best thing that you can do in your life, and you will remember all these moments that you passed at the university, laughing back at funny situations that you lived. Now, since this is a recorded session, if you have any questions, you can feel free to write at me using my email. And I would like to thank you for following through this presentation. I hope you found it interesting, and I'm going to leave you for the next presentation of this very interesting orientation program. Bye.
Dr. Douragis. I would now like to welcome back Dr. Konstantinos Michailidis, who will present to you Moodle and independent study resources available to you.
Welcome again. It's nice seeing you. I will spend a few time talking a little bit about Moodle, what Moodle has to offer, what is independent studies, and where you can find valuable resources. So this is the outline. Moodle okay, by now everybody should have your credentials. They should have been given to you by the IT department. You can enter the platform through a link in the main website page of our school. Once you click on the link, this page will pop up, and the system will ask you to enter your credentials. If some of you do not have their credentials yet, please contact the IT department and they will be happy to assist you with that. So once inside, you will go to School of Medicine, then click on Fall 2020, and then First Year. Once inside, you will have access to all of your courses. Please note that almost all of the courses in our 6-year program use Moodle. There are some exceptions like histology or pathology, which use a different type of system, but for the most part, most of the courses are found in Moodle, so you will be using a lot of it in your next 6 years. Also keep in mind that in order to have an access to a particular course, you need to have a password, an enrollment key. Each course has its own, and you will be given this key by your course instructors. The interface of each course is separated in weeks, so everything you will need regarding a particular week, for example, a lecture or a lab plan or the report that you will have to submit, you will find in that corresponding week. So what is Moodle? Moodle is an online learning platform designed to provide educators, administrators, and of course learners such as yourselves with a single system in which we can create a personalized learning environment. It is built around the student needs. It is an online environment where you can be interactive, not just with your teachers, but also with your classmates. What Moodle provides us with are endless means of education that focus more toward active learning. As I said, the capabilities of Moodle are endless. In Moodle, you will find all your lecture slides for each week, your lab plans, so you will know in advance what you will be asked to do during your labs, and if you have to be prepared for something. Also, all the courses announcements will be here. You can have discussion forums. Videos could be uploaded and then discussed and commented on. More than that, Moodle is a very engaging and fun way to have assignments and quizzes. These could and should be graded, and the results are then uploaded in the same platform. So you can instantly refer to previous or current slides, see your weekly task, and receive feedback on your achievements. A few tips to help you get the best out of Moodle has to offer. Check your courses frequently for updates. Your instructors will be constantly uploading new files, so make sure that you keep track on what is new. The best way is to check your emails. When something is uploaded, you will get a notification. So make sure that this email account is active, one that you actually use, and that your notifications are not thrown in the spam or junk mail. Always remember your credentials. A few words on independent study before I show you where you can get your resources. This is a form of educational activity that you do with little or even no supervision. Usually, we, the instructors, agree with you upon a topic to research, and we guide you to do it on your own. This is interesting for two reasons. One, the students make their own decision and choose how and what they will search. And secondly, for us, it's also interesting because we get a feel on what students find interesting and what you think is more important about a specific topic. Additionally, independent study gives you the advantage to have access to it from everywhere, at any time and at your own pace. It allows repetition. You can repeat the same function, the same report or the same question a lot of times. It helps you identify if you have and where you have weak spots. It prepares you for interactive discussions with the faculty, and you should know that this type of study is used in combination with lectures and face-to-face labs, of course during this time period, because we have a lot of online sessions. Most of the labs will be online. What resources can you use? The easiest answer to that is websites. There's an abundance of sites out there, whether you're looking something about biochemistry or physiology or neuroscience or surgery, you'll find it. There are websites that contain a lot of subjects, such as the one I'm showing you here. You should know some of them are free and some of them are not. There are also websites which are dedicated to special courses, such as, for this example, histology. Histology Guide, for example, is just meant for histology. These sites overall can help you understand fundamental aspects of the structure and function of cells, tissues, systems, organs. This will help you to combine and integrate all the things you will learn in each course. Apps, of course. You can find a lot of apps using your phone. There are apps for any type of topic you can think of. For instance, this particular one contains many neuroanatomical images, both normal and also abnormal. You can self-test your level of knowledge in neuroscience or in neurosurgery. So there are a lot of means you can do that, by which you can do that. Social media. There are a lot of organized groups or individual people that have in social media that you can join and receive notifications on new and interesting cases. Now, YouTube. YouTube is an extremely powerful educational tool. At least for my part, I think it is the strongest of all. There are some things that words alone cannot describe, and as much as someone tries to use their imagination to understand something, it still might not make sense. YouTube, most of the time, because it uses both audio and video, makes things so much easier, not just for you, but also for us instructors. So take advantage of that. There are websites with virtual patients. Here I'm showing EVIP, which is an European-funded program. This might contain archives of cases from which you can learn. You can read the symptoms of a particular patient. You could be asked what treatment you could choose and make a diagnosis upon that. For those of you that want something more than what I just mentioned, you can always choose to follow an online course. There are a lot of free online courses. In a lot of sites, you just need to register to the appropriate website. It does not have to be strictly related to medicine. You can choose to learn something about intercultural communication or teamwork and collaboration, things that you feel that might be of use in your later year as a medical doctor. So, putting everything in conclusion, independent study resources could be found in websites, in applications, in short videos such as YouTube's, software, social media, virtual patients, online courses, and of course, e-books. Thank you for your attention.
Thank you, Dr. Mihailidis. It is now time for you to meet your academic advisors. We would like you to visit the links that were given to you And please keep in mind they are personalized, so please attend at the time that was stated in your emails. From us, thank you very much, and we hope to see you soon. Thank you.